Why do diuretics fail for some ascites patients? Imagine trying to drain a bathtub that keeps filling up no matter how much water you remove. That's similar to what happens when diuretics don't work well for some people with ascites. Ascites is the buildup of fluid in the belly, often caused by liver problems. But why do medications meant to help sometimes fail? The answer lies in the complex ways liver disease affects the body. When the liver is damaged, especially in advanced stages, it causes increased pressure in the portal vein, which carries blood from the intestines to the liver. This is called portal hypertension. As pressure builds up, blood pools in the blood vessels of the intestines and abdomen. The body senses this as a drop in effective blood volume and responds by activating systems that hold onto sodium and water. This includes the renin-angiotensin-aldosterone system and the sympathetic nervous system. These responses cause the kidneys to reabsorb more sodium, leading to more fluid retention, which makes diuretics less effective. In some cases, the kidneys themselves become less responsive. Cirrhosis can cause changes in kidney function, especially in severe cases. The kidneys may start to retain sodium excessively due to high levels of aldosterone or increased sensitivity to it. Even if diuretics are used, they may not be able to overcome this sodium retention. This situation is called refractory ascites, meaning the fluid buildup no longer responds to usual treatments. Another reason diuretics may fail is the development of hepatorenal syndrome, a serious condition where kidney function worsens because of liver failure. When the kidneys cannot excrete sodium and water properly, diuretics lose their effectiveness. Sometimes, the kidneys are simply too damaged or the blood flow to the kidneys is too poor, making diuretics ineffective or even risky. Resistance to diuretics can also develop through neurohormonal changes. For example, increased aldosterone activity can counteract the effects of loop diuretics, which are commonly used. To try to improve results, doctors might add aldosterone blockers like spironolactone. But if kidney function continues to decline, even these combinations may not work. Sometimes, trying to push the diuretics too far can cause problems like electrolyte imbalances, dehydration, or low blood pressure. These side effects can force doctors to reduce or stop diuretics, which limits their ability to control ascites. Other factors like infections or cancer can also make managing ascites more difficult. When diuretics fail, doctors may turn to other options. Large volume paracentesis involves removing fluid directly from the abdomen with a needle. For more severe cases, procedures like transjugular intrahepatic portosystemic shunt can help reduce portal hypertension. Ultimately, for people with advanced liver disease, a liver transplant might be the only definitive solution. In summary, diuretics may not work in some ascites patients because of the complex effects of liver disease on blood flow, kidney function, and hormonal regulation. Managing this condition often requires a combination of treatments and careful medical supervision. If you or someone you know faces this challenge, it's important to work closely with healthcare professionals who can tailor the best approach for individual needs.